Hey everyone, today we're diving into something you might have heard about but might not really understand: schizophrenia. It's a serious mental health condition that affects about 1 out of every 100 people worldwide. That may sound really rare, but it means millions of people have this condition and are living with it, especially teens and young adults, as symptoms often start to show up between the late teens and early 20s. So, what exactly occurs when someone has schizophrenia? There are a few main groups of symptoms when it comes to schizophrenia, and they can vary from person to person. Hallucinations. This is when someone's senses trick them. The most common are auditory hallucinations, like hearing voices that no one else can hear. These voices might whisper, talk, or even shout. Some people might see things that aren't there, like shapes, shadows, or even full images. Those are visual hallucinations. Less commonly, people might smell or feel things that don't exist. Delusions. These are strong beliefs that don't line up with reality. Someone might think they're being watched or followed, paranoid delusions, believe they have special powers or a secret identity, grandiose delusions, or feel like random events, like a TV show or a song on the radio, are sending them hidden messages just for them, referential delusions. Disorganized thinking and speech. This shows up when a person's thoughts get jumbled. They might jump between totally unrelated topics mid-sentence, use made-up words, or struggle to organize what they're saying. To someone listening, it can feel confusing or hard to follow, but to the person speaking, it might make perfect sense. Movement changes. Schizophrenia can also affect the body. Some people might move in unusual ways, sit completely still for long periods, or repeat certain gestures. In rare cases, they might go into what's called catatonia, where they barely move or respond at all. Negative symptoms. These are the less obvious signs, but they're just as important. Someone might lose interest in things they used to enjoy, stop showing much emotion on their face or in their voice, struggle to get out of bed, or pull away from friends and family. It's not because they don't care. Their brain is making it harder to connect and engage. Scientists aren't exactly sure what causes schizophrenia, but there's a lot of evidence it's linked to genetics. If someone in your family has schizophrenia, your risk of getting it is higher. However, that doesn't mean you'll get it. Stressful environments play a role too. Things like poverty, trauma, or even complications before birth can increase the risk of schizophrenia. The good news? Schizophrenia can be treated. Treatment usually includes medication to manage symptoms, therapy, and lots of support from family and friends. The earlier someone gets help, the better the chances of managing symptoms and living a full life.